Hello, my name is Tondi. I work in the nonprofit sector, and I'm also a person living with HIV. And I wanted to share some thoughts on stigma with you guys, if that's okay. I also work in the field doing outreach and connecting with people in the community. And what I find is, as you all know, or maybe some of you don't know, stigma is, it's the main reason why few people have what we call falling out of care, but really it's a fear of a sense of stigma is just a big sense of shame that keeps people from taking care of themselves. And this is a big public health concern. Why is it a big public health concern? Because there are people living with HIV and they're not going to the doctor and they're not taking their meds. Well, they could become highly infectious. I don't like to say infectious, but the particles of HIV in their body could rise, and they can more than likely pass on and transmit the virus to someone else. This is also the case for people who have never tested for whatever reason, because stigma also keeps people from taking an HIV test. How do we stop it? Basically by changing mindsets, and that's going to take some time. I know it's been 30 years, maybe more, since the first case of HIV or AIDS came out in the 70s, but still there's a lot of fear and stigma today, especially in areas of the South, but not even just in the South, even where I live too. And there's people, that are afraid to come out and be honest about their status just because of that fear of rejection. How do I know? Because I was that way, especially when I was first diagnosed. You really don't know the experience of someone living with HIV unless, you're actually living with the virus yourself. And it's incredibly hard to disclose to everyone, especially the people who mean a lot to you. And that was the case for me, because I have this fear that I could be left and abandoned by those that I feel I need in my life the most. But I'm fortunate in that I got support quickly right after my diagnosis. I got into treatment quickly. I take my meds every day. I make sure I take care of myself. And really it's because of my diagnosis with HIV that I go more frequently to the doctor and get screened for everything else. I have a good relationship with my doctor. I have a better relationship with my health, and I'm more involved with my health as well. But I still see that there are people that are in the margins or on the outskirts who are afraid of coming in and taking care of themselves. And it makes me sad, because really all they need to do is just come into the clinic, but they can't. And the reason they can't is because they fear they may be seen and judged for taking care of themselves. So we have as a society, you see, need to consider changing our mindset, because it really is a public health issue. This infection can happen to anyone. It could happen to, it's in large portions affecting the African American community here in America, but it's a major issue all around the world, still. And it's not, and in other countries, it's not easy to come out and say, oh, I have HIV, because there's real stigma in those countries, especially in Asia and in places of Africa, people really could get killed just for saying I'm HIV positive, you know? So you also gotta be aware of that. So I just wanted to make a public statement and just inform people how stigma really hurts people. And this is not just in HIV, this is in other issues as well. Mental health. There are people who are afraid to go to the doctor and be seen because they don't want to be labeled as mentally ill. We put stigma on people who are who are living with schizophrenia, and you know, sometimes that could inhibit a person from actually reaching out to get help, especially if they need it. I just ask that simply people start thinking about how they say and what they say, because someone who's living with that condition may hear you, and you know, I don't want to. It sucks to allow a label to suppress you from getting the help you need. That's all I gotta say. Thank you. Bye.